And good evening, everyone, and welcome to this Facebook Live episode of the Your Health is Important radio broadcast. I am Dr. MJ Collier, host, producer, and on-air personality, and we are so glad to have you here joining us this evening. This is your opportunity to ask your healthcare questions in the only interactive healthcare forum that allows you to do that. So thank you for tuning in. We know you have options, but we're going to answer your healthcare questions today. Thank you. So, Havoc, thank you so much. Our producer and call screener is in the house, and he's going to be talking to you as well and answering your questions. So a couple of things, let's get our monologue out of the way. First, it's flu season. It is flu season. It is flu season. So get your flu shots now. The flu shot is available, is readily available in virtually any pharmacy, any place that you get your prescriptions, you can get it. You do not need a prescription to get your flu shot. It's covered by all insurance products. If you do not have insurance, you'll have to pay a minimal amount, $15, $20, but it is well worth it. One, is a good match to the flu that's coming out right now. Two, it also will supercharge your immune system and give you a better way to get through what I expect is going to be a pretty tough winter, because we're going to have two infectious diseases that we have to fight. We still have the COVID, the coronavirus, the coronavirus 19. It is amazing how we are still having to deal with this. I am seeing patients literally on a daily basis that are testing positive for COVID and having symptoms. Most of them it's more like a bad cold, the flu, etc. But I do have patients with persistent shortness of breath, a few that have been hospitalized, and we're still having a death rate of about 400 people per day in the United States of America that are dying from COVID. So do not forget about the COVID. So two things that Dr. Collier recommends. One, that you don't get the flu shot and the COVID vaccine at the same time. That recommendation has been okayed by the CDC. However, why make your immune system work double overtime? Let's make it do one thing well. You get your flu shot now, today. As soon as the next time you go to the pharmacy, the next time you're in the grocery store shopping, if they have a pharmacy, you can probably walk up and get your flu shot. It's not big crowds there. You can do it. Get that. Then plan on getting your next corona vaccine, your new bivalent booster that is available now, but plan on getting it around October the 15th. You say, why, Dr. Collier? Why should I wait? One, because at that time you will have peak immunity around Thanksgiving and Christmas. During the Christmas holidays, you'll be gathering at work, Christmas parties and holiday functions. You'll be around a lot of people, and there's no 6-foot mandates. People are not wearing masks, so it's important that you optimize your immune system function. Get that new bivalent booster. If you have had, you can only get it if you've had at least 2 of the primary shots. If you have not had 2 of the primary shots, you need to start that series as quickly as possible. So get your flu shot ASAP, yesterday. The next time you go to the grocery store or the pharmacy, then get your coronavirus booster, the new bivalent booster. It's the only booster that's available. Now, they're not giving the other boosters. So if you get a new booster, it's going to be that booster unless you have not had your 2 primary shots. And that's 2 doses of the Moderna, 2 doses of the Pfizer, or 1 dose of the Johnson & Johnson. And might not be a bad idea this time. I had not recommended the Johnson & Johnson. If you have not had any vaccine, you can get the Johnson & Johnson, and 2 weeks later you can get the Moderna or Pfizer bivalent booster. Again, my preference in vaccine is Moderna first, then Pfizer. But, there's not a lot of difference between the two. I just think that the Moderna is a little stronger and works better and lasts longer. But you still will get reasonable immunity from the Pfizer. So if you do that, then move forward with it. So I hope you had an opportunity to listen to the Wellness Wednesday broadcast on each morning on the Ricky Smiley Morning Show. It airs Wednesdays at 8:20 a.m. Eastern Standard Time. So make your adjustments across your time zones. And there's usually delayed play as we move from east to west. But if you listen to it, you don't have to worry about finding the station. Just go to your cell phone and say Siri or Alexa, Ricky Smiley Morning Show, And then you can say Dr. Collier segment, or you can say Wellness Wednesdays, or multiple variations thereof. Remember, you can reach me on all social media. That's Facebook, Instagram, at Ask Dr. MJ. Go to my YouTube channel, Ask Dr. MJ. We have many videos and lots of healthcare information there for you to do it. And now let's get this party started. So Havoc is ready to screen your calls. Let's find out who you are and where you're tuned in from. You know how to do it. All of our regulars, I hope you're in. And then I hope we have new people that have been invited. I want people from the north, south, east, west. Nikki from Montgomery, Alabama. Sherelle. Okay. Thank you so much for being here. Ernest Gibbs. Ernest, my man. Hello from Rock Hill, South Carolina. Ernest is I think, has been here since every show. Carolyn Brown from Detroit, Michigan. Okay, we got Michigan in the house. We're on the East Coast. Patricia Crawford. Hey, Pat. Thank you so much for tuning in. We appreciate you. C.L. Turner from Baton Rouge, Louisiana. Now we're talking my people, my favorite food. Janai Allen from West Palm Beach, Florida. I hope you are doing well, Janae. So be safe, hunker down there. Rachel Harrison from New Orleans. All right, Rachel, thank you so much for being here as well. Sean Big Time Green from Monroe, Louisiana. Big Time is in the house. He is also a regular and probably has been on every show. Winnie King from Terrell, Texas. Winnie, thank you so much for joining us. We appreciate you. Okay, Lewis Kelly Sr. in Winter Haven, Florida, in the storm as we speak. We are praying for you now. The winds are 100 miles per hour. So everyone, I want everyone listening to pray for the people in Florida. This is amazing, once-in-a-lifetime storm. Okay, Willette Carter, trying to stay safe from Hurricane Ivan in Lakeland, Florida. Miss Makiba Boland, local Douglasville, Georgia, right outside of Atlanta. Okay, DeAndre Brown from Lauderhill, Florida. Everybody's in Florida. Good, I'm so glad that you are safe, that you have power, and that you were able to tune in. Hello, Cynthia Allen from Houston, Texas. Okay, Denise Irby from Massachusetts. Now we're moving up the East Coast. All right, Catherine Wright, Cleveland Browns playing the Falcons this weekend. I will be at the game. Let's hope that that is a good game. Sorry that one of your players was in a car accident. Miss Todd Jr., Renee, Indianapolis, Indiana. Renee from Indianapolis. Sharice Palmer from Princeton, Texas. Thank you, Sharice. We sure appreciate you being here. Janae Walker from Birmingham, Alabama. All right. Beham. Anissa Christian from Memphis, Tennessee. Thank you, Anissa. Priscilla Wortham Wilburn from Stone Mountain, Georgia. Thank you so much, Miss Priscilla. We appreciate you. Charlie from Chicago, Illinois. Hey, Charlie, how you doing? All right. Jimmy Gray. Soup from Billings, Montana. Wow, you're the first, Billy, from Billings, Montana. Sounds by pounds, Peoria, Illinois. There we go. All right, Lisa Russell, Sanford, Florida. Sanford, I love Sanford, just north of Orlando, and probably going to be impacted by the storm as well. Jules from Philly. All right, Jules Storm, thank you so much. Chandra Beeman from Phoenix, Arizona. All right, Chandra, we appreciate you turning in. Now we got the West Coast covered. Anybody from California, LA? Okay, Lanice Spikes from Ohio. Hello, Lanice. We appreciate you being here as well. Fern Hurd McBride from Houston, Texas. All right, Texas is in the house. Carolyn Ajaya from Miami, Florida. Carolyn, please hunker down. I hope you're not at home dealing with this storm. Lorraine Daniels from Maryland. Thank you, Lorraine. We appreciate you for tuning in. Arnita Norris Grice from Mississippi, Mississippi. Thank you for tuning in. Dee Turner from St. Louis, Missouri. Now we on the West Coast, Midwest. Let's do it. Darlene Scruggs from Dallas, Texas. Okay, Darlene, we appreciate you. All right. Thank you, Havoc. We appreciate that. And we will be listening during our roll call a little later in the show. But right now, let's get to your healthcare questions. We're here to answer them. We introduce our topic today. We're going to talk about, Charlie says, what should you do when you take an estrogen blocker for cancer, but it's affecting other things in my life? That is exactly what it does, Charlie. It makes your vagina dry. It makes your vagina thin. It decreases your sex drive tremendously. So there are ways to address that. The main thing is staying as healthy as you can otherwise, making sure you're getting enough rest, making sure you're eating healthy, as they say, but also making sure that when having intercourse that you are appropriately lubricated. Use a water-based lubricant. That is the best kind. Never, ever, ladies, never, ever put an oil-based lubricant such as Vaseline in the vagina. Not a good thing at all. Causes infections virtually 100% of the time. And just, it's like putting fire down there. It's petroleum based. So a water based lubricant, Astrolube, is excellent for that. And of course, the most friendly KY jelly. And again, saliva is also a great lubricant. You just got to have enough of it. So make sure that you are well lubricated and that you are not traumatized from the active intercourse, because it can be unpleasant when you are low on estrogen. There are also natural estrogen substitutes, particularly plant-based estrogens called phytoestrogens that you can get in any health food store like GNC, the Vitamin Shop. Go in and talk to a counselor and let them know that you're on estrogen blockers and that you want some supplements that can help boost some of those side effects that you're having. Those are perfectly okay. They will not interfere with your cancer treatments, and they will allow you to live a more happy and normal life. All right, great question. Okay, I'm diabetic. Can I take Lipodrops? It's hard to lose weight and I'm on insulin. Catherine, right. Great question already. Might be the question of the day, because when you're diabetic and you're on insulin, insulin stimulates your appetite. And so the doctor tells you eat less and don't eat as much, yet they give you insulin, and insulin makes you. You can't resist it. It makes you. It drives you. It beats you that you have to eat to relieve that drive, that craving for foods. Is what insulin does. So, of course, Lipodrops perfectly compatible with insulin and with the vast majority of medications for any disease state. What the Lipodrops do is alter your body's metabolism and your body's response to foods so that you metabolize foods more efficiently. Those foods are broken down and used as energy and not stored as fat. So you take a dropper full of the Lipodrops, put it under your tongue, hold it under your tongue for about 2 minutes, then swallow it. It is absorbed under the tongue. Doesn't matter whether you swallow it or spit it out. It's absorbed under the tongue. That is exactly like taking an injection. It is a very efficient way to transmit and ingest medications under the tongue through that mucous membrane. So very good way to do it. Depending upon how much you want to lose and how quickly you'd like to lose it, then you go once a day or before each meal. You can do it about 15 minutes before any meal, breakfast, lunch, or dinner. That will give you greater weight loss in a shorter period of time. So Lipodrops compatible with diabetes, and the answer to the question is yes, you can take them, and they will make you lose weight, which will help with the diabetes. Okay, next question. Can I take phentermine with your Lipodrops and probiotics? DeAndre Brown, yes, you can. As a matter of fact, in one of my weight loss facilities, that is one of our more aggressive techniques for getting weight off of you. Phentermine is a medication that decreases your appetite. It also speeds up your metabolism, so it makes you lose weight because you're not eating as much and you're burning calories that you do have. And so patients are placed on phentermine if it is appropriate to take it. If you have uncontrolled high blood pressure, you can have high blood pressure, but you have to be taking your blood pressure medication and keep it controlled. So make sure that you're doing just that. Also, that you have not had a heart attack and have not had a stroke. If you have not had a heart attack, if you've not had a stroke, and your blood pressure, if you have high blood pressure, is well controlled, you are eligible for phentermine. You must take caution if you have thyroid issues and you're on thyroid medications, however. So you need to take it in conjunction with a physician that is well trained and versed in how to use phentermine for weight loss, and then you can do that. So then we will add the Lipodrops, or we will usually also add, we will even add our Keto Max product, the probiotics, and the Lipo Cleanse. That is our ultimate take everything, lose as much weight as possible, as quickly as possible process. So yes, the phentermine is compatible with the Lipodrops, and a technique that I do recommend. Next question. What can you take for brain health? Boy, I wish I could answer that question. There are just basic good nutrition, and then a lot of the problems with the brain, things like Alzheimer's, dementia, etc., are due to inflammation in the brain. They are figuring this out and finding this out. They thought that plaques in the brain, when they do a CT scan or an MRI on a person's brain, when they have dementia, they're looking for plaques. They thought that the plaques were a pathological indication that was the problem and the cause of the disease state. What they have ultimately found out was that the plaques are a response to inflammation in the brain, and that if you take care of the inflammation, you won't have plaque formation. That it actually is trying to protect the brain from whatever the inflammatory source is. My personal theory is that it is a virus. Epstein-Barr virus has been found to be prevalent in individuals with dementia, particularly Alzheimer's dementia. Also, the herpes virus can do so. But how do you treat the problem? With anti-inflammatories. The two best are vitamin D at a therapeutic dose of 5,000 international units per day. I highly recommend the Dr. D product that's available on the Lipodrops.com website. Also, omega-3 fish oil, which is amazingly good for cardiovascular health and to decrease inflammation that can cross the blood-brain barrier and help give you protection. There are multiple products that you hear about on the internet and online that I have found to show no real benefit as far as brain health is concerned, when they particularly talk about take this for improving memory, etc. But I have patients that have taken them and said, that they feel like they've benefited from them. So, they're easily obtainable, easily just Google brain health, and they'll give you several options. I won't name them because I don't endorse them. But again, the problem is inflammation. You treat the inflammation with vitamin D and omega-3 fish oil. Part of Dr. Collier's 3 things that everybody should take, including, so my 3 things that Dr. Collier recommends that everybody, male, female, young, old, black, white, green, purple, everybody should take those 3 things. That's vitamin D at 5,000 international units per day, omega-3 fish oil, and probiotics. Those will optimize your body's health, probably extend your life and give you just a great overall sense of well-being. Those are 3 things that I take personally every day, and I highly recommend that you do as well. That's Dr. Collier's Trio for Good Health, and available on the website Lipodrops.com. Great question, Anita. Janae Allen, I got the new booster shot a week ago, and I plan on getting my flu shot in the middle of October. Does the order really matter? Yes, it does, and for the reason that I explained. The flu shot is one, the flu is going on right now. 2, you would not have gotten the booster if you had not already had at least 2 of the other coronavirus vaccines. So you already had immunity. The objective is to give you the optimal immunity during the holiday season, which is why I say take it after October the 15th. But you've already gotten the flu shot now, so you can get it anytime. 2 weeks after the flu shot, you can get it. So I'm sorry, you got the booster. So now you can get the flu shot. I recommend anytime 2 weeks after that. You don't have to wait till the 15th, but that is just a little over 2 weeks from now. So you can do that. But other than that, remember to optimize your immune function by taking the omega-3 fish oil, the vitamin D, as well as Dr. Collier's Lipo Immune product, which has 3 things in it. It's got vitamin C, it's got elderberry extract, and it's got zinc. Those 3 things, plus the other 2 things that I talked about, will optimize your body's natural immune response. So, do what you need to do to stay healthy this winter. It is expected that we're going to have a severe flu season and a severe COVID season. So dual pandemics during the wintertime. So protect yourself now. Do not hesitate to wear a mask if you're in a public situation, which you think is appropriate to do so. We still wear masks at my doctor's office. I'm still seeing patients every day, literally every day. Saw 2 today with COVID. So important that you remember that it's still out there and you protect yourself from it. Next question. Thank you, Happily. Okay, Marlene. My mom has been diagnosed with bronchitis. She has taken doxycycline, but her cough is still sounding bad. Does it take a while for it to go away? She also has COPD. Yes, it does. The chronic bronchitis can be a problem. Doxycycline is an appropriate antibiotic for doing so. The dose that would be therapeutic for that medication would be a 100 milligram tablet twice a day. Need to take it for 10 to 14 days. But not just that. Oftentimes, doctors will just give the antibiotic, but they don't treat the other symptoms. I will always add a Mucinex product, particularly for your mother's bronchitis. I would give her Mucinex DM, dextromethorphan, maximum strength, which is now actually available over the counter. Doctors can write prescriptions for it. I do every day, but you can get it over the counter. That's 1,200 milligrams of the mucolytic that you need in there versus 600. A 600 milligram tablet is the standard dose, and you just have to take so many of those pills. And if it's 400 milligrams, you got to take 2 every 4 to 6 hours. That's a whole lot of medication. When you can get the maximum strength tablet, take 1 twice daily. The dextromethorphan helps control the cough, and so you will take that 1 twice daily along with the doxycycline, and that will help. There's also a prescription medication called Tessalon. These pearls work internally on the diaphragm to help control coughing. And then there's, of course, your traditional cough syrups. Codeine, cough syrups that contain codeine are prescription, and they are very effective for controlling cough in doing so. So I will always give a patient multiple therapeutic regimen to help control their symptoms. 1, inflammation; 2, cough; and then a non-sedating antihistamine. I like in this order: Allegra, Xyzal, Zyrtec, and Claritin. All available over the counter now, and they will help with some of the other symptoms that your mother is explaining. I hope she is not a smoker. If she is, she needs to stop smoking. It amazes me when people come to my office and they have a cigarette in one hand and they're Dr. Collier, I'm coughing. I can't stop coughing. Yet they continue to smoke. So it is a problem, and I hope that your mom is not one of those individuals. All right, great questions tonight. Thank you so much. Next question. What can you do about sciatica? Is it a sleeping posture, shoe posture, hurting every day? It's a little of all of those things. The main reason that people get sciatica is because the sciatic nerve, a pressure point is right in the middle of the buttock. So that nerve comes out of the back. It is literally a bundle of nerves that is 5 nerves that become 2 nerves, then 1 nerve, and goes all the way down the leg. So when an individual tells me they have back pain that radiates down the leg all the way to the foot, there is no other thing that causes that except sciatica. I do not have to do a CT scan. I do not have to do an MRI. You can make that diagnosis based on history and physical examination. If they have what's called a positive straight leg raise, that's when you're sitting down and I take your foot and lift it up and straighten your leg out. And as I do that, it causes increasingly severe pain. A positive straight leg raise is indicative of disease state in the lumbar spine, sciatica, and a ruptured or bulging disc. I do not have to x-ray you to find that out. I tell people the only real indication for doing a CT scan or an MRI is if you had a major trauma, if you fell off a roof, if you were in a major car accident, and you had significant and substantial trauma to your back. If you cannot walk or if you cannot control your bowel and bladder. Other than that, we know what the problem is. It's not going to change your therapeutic options. Physical therapy, anti-inflammatories, muscle relaxants, something additional to control pain if you need it, and tincture of thyme. You can do nothing for these sorts of things, and the pain gets better usually in a couple of weeks, no matter what you do. But if you do everything, range of motion exercises, anti-inflammatories, muscle relaxants, some people love hot packs, some people like cold packs, some people will alternate ice packs and warm packs, whatever it takes to give you relief. But the main thing is keep moving and stretch that back out so that you get relief. The problem is you don't feel like moving. It hurts. It can be debilitating. But you have to stretch that spinal cord out and make sure, particularly for men wear these big, thick, fat wallets. And the older you are, the fatter your wallet, the more pictures, the more credit cards, the more money you have in your wallet. But when you put it in your back pocket and sit on it, it is a direct pressure point on the sciatic nerve. So don't wear your wallet in your back pocket. Wear it in your front pocket or in your jacket pocket if you're wearing a jacket. I would recommend wearing one outside with a chain on your belt because that's easily lost or snatched. But you do not sit on that wallet, gentlemen. Women have purses. It's not a problem with them. But depending upon how much cushion they have in the back. If you got a lot of cushion, then you're probably okay. But if you got minimal cushion or no cushion or, a sway back, so to speak, and then you got minimal butt tissue, then you might have some problems with that sciatic nerve. Okay, then make sure posture maintained, feet straight, shoulder width apart, back straight, flat on the floor. Crossing your legs creates the problem. Twisting while doing something in a chair creates a problem. So those are things that, you can just Google range of motion exercises for sciatica, and that will literally give you the best benefit that you can get from that? Great question. Okay. Chandra Beeman, what are my thoughts about sea moss? Is it good for you? Sea moss is great for you. It is a great anti-inflammatory. It helps lower your blood sugar. It helps insulin and glucose be metabolized better in your body. Sea moss has, again, multiple digestive benefits. It is a great supplement and one that I recommend along with, vitamin D and omega-3 fish oil. Sea moss is a good supplement. Other supplements you may have heard of, black seed oil. Dr. Collier is a strong proponent of black seed oil. Most people have it, but guess what? It doesn't do you any good sitting on your kitchen table or in your medicine cabinet. You actually have to take it. You have to take it every day, and then you'll get your optimal benefit from it. So if you take supplements, for instance, my vitamin D, I take my vitamin D in the morning. When I wake up in the morning, I rinse my mouth out, I take my vitamin D. I brush my teeth, I take my omega-3 fish oil. I brush my teeth, I shave, then I take my probiotic. There's no reason to stretch and point. You could literally put all three of them in your hand at one time. But why do that? I got time. I'm going through my regimen in the morning. That gives each medication a chance to dissolve, get out of my stomach and into my system so they're not interacting in my stomach. And it literally, if you take a full glass of water when you take these medications, any medication for all practical purposes, and it only takes about 2 minutes to be absorbed and get out of your stomach. And then while you're waiting, you can take the next pill. Now, that's also hydrating you in the morning as well. But if you have not been doing that and all of a sudden now you're taking 2 or 3 full glasses of water in the morning, make sure you empty your bladder before you get in your car going to work, because if not, you're going to be challenged. It can be a problem. It can be a problem. So make sure that if you're drinking water that you traditionally don't do in the morning, make sure you empty your bladder. And then you'll probably, by the time you get to your workplace, you'll probably have to empty your bladder again. This is a good thing, though. Rinse you out. Most people that live long lives, they will tell you they drink lots of water because it just has such great benefits. And when you wake up in the morning, after you've emptied your bladder, it's good to put that fluid back into your system. Okay, great question. Next question. Can I take Ozempic and Lipodrops at the same time? Absolutely, Sharice Palmer. You can take Ozempic and again, one of my new regimens, because the Ozempic is new for weight loss if you are diabetic. If you're not diabetic, the exact same medication is available under the brand name Wegovy. It is literally the exact same molecule made by the same company. They just don't have a weight loss indication for Ozempic. It's one of the benefits. If you're diabetic, you take Ozempic, it lowers and controls your blood sugar, it lowers your hemoglobin A1C, and it makes you lose weight. All great benefits if you're diabetic. If you're not diabetic, you take the same medication as Wegovy, you lose lots of weight. It will not alter your blood sugar, won't make your blood sugar go too low, because it is a glucose dependent response. So it is absolutely amazing, the benefits from Ozempic. There's another newer medication called Mounjaro. It operates at 2 receptor sites. The Ozempic operates at 1 receptor site. The Mounjaro operates at 2 receptor sites, but it is also only has indication as of now for diabetics to lower their blood sugar, lower their hemoglobin A1C, and also help them lose weight. But they are seeking avidly a weight loss indication. And I actually saw an article yesterday that they are actively seeking an indication for the treatment of Alzheimer's disease, because both of these medications have shown to show benefit in people with Alzheimer's. So in slowing the progression, preventing the onset of, they are looking at all these possibilities. But this medication and this class of drug, GLP-1 inhibitors, have so many benefits for the human body that they're going to be standard therapy soon, without question, because they will result in dramatic and amazing weight loss, which literally benefits every disease state you can have, from arthritis to depression to kidney disease to high blood pressure to diabetes to high cholesterol. All these things benefit from weight loss. And so you're just a better, healthier person. And so insurance companies will soon recognize this, that it's best to keep a person healthy than it is to try to treat a disease state like diabetes, which is lifelong disease state management, complications of which are heart attacks and strokes, very expensive, very expensive. The number one most expensive medication that the national government has to pay for under the Medicare program is a blood thinner The number 2 is a diabetes medication. They spend billions of dollars on those 2 medications alone. Imagine if you could keep people healthy and did not have to do that. They kept their diabetes under control, kept their weight down, etc. How much money overall will be saved in the healthcare system? We have the most expensive healthcare system in the world. We have probably middle of the road as far as effectiveness is concerned. There are people around the world spending much less money and having much better outcomes than we do here in the United States. Why? Because healthcare has become a commodity. It is not the reason they have healthcare businesses now. They are a business. It's not to keep you healthy, but it's to sell products or services. The objective, it used to be to keep you healthy. But now keeping you healthy is, somewhere on the list, but not at the top of the list. The objective now, whereas in other countries, that is not the case. The objective is to treat your disease state, keep you healthy. And so we're going to have to rethink how we approach healthcare here in the United States, because we are losing this battle. We're spending far too much money and getting far too poor outcomes when people that have less technology, less money, but have much better outcomes than we do. In virtually most of your end-stage disease states. So that is an issue that we have here in the U.S. we have to address, hopefully in our lifetime. Next question, Abby. Priscilla Wilborn, how much weight can you lose on the Lipodrops? It depends on how much you have to lose. The weight loss, I tell people, is directly proportional to how much you have to lose. So if you are 150 pounds, you only need to lose 10 pounds, you're not going to lose 50 pounds. But if you 200 pounds, you need to lose 50 pounds, you can lose 50 pounds. We have had patients that have lost over 100 pounds because they needed to lose that much. So it depends on a variety of factors, as in also, again, whether you're following the 5 meal per day plan, which is breakfast, lunch, and dinner, a snack in between breakfast and lunch, and a snack between lunch and dinner, or whether you're following the 8-hour intermittent fasting diet plan, and then whether you're getting any exercise. Now, understand this, you do not lose weight in the gym. You heard Dr. Collier. You do not lose weight in the gym. You get fit and healthy in the gym, but you do not lose weight in the gym. You lose weight in the kitchen. So what you're eating, how much you're eating, number of calories that you're taking in, all of these things will vary. But what the Lipodrops do are potentiate again, how you and alter the way that your body metabolizes foods, makes it much more efficient and allows you to lose weight in the right way. So you lose predominantly fat, not a combination of fat and muscle. Under a standard calorie restriction diet, for every 15 pounds you lose 10 pounds of fat and about 5 pounds of muscle. The problem is that if you lose 30 pounds and you gain it back over time, you gain back all fat. So you have shifted your body's somatotype, which means now you have more fat. You have an additional 20 pounds of fat that you didn't have before. And even though the number on the scale may be exactly the same, your body has changed. Your ability to metabolize insulin and utilize insulin to get glucose out of your bloodstream and into your muscles so that it can be used as fuel has been altered. And you're now, a lot of people say we're overweight but thick and looked healthy. Now you got the same number on the scale, but you're now doughy. You now are softer, you are less fit, and you're less healthy. So with the Lipodrops, the objective is to make your weight loss 98% fat only. So if you lose the fat and you, for whatever reason, if you happen to gain it back, you're no worse off than you were when you first when you started the process. But our objective, of course, is to keep the weight off of you. And by doing that, you can do that by going into a maintenance program that could include utilizing Lipodrops at least once a day versus the 3 times per day method that we talked about for more aggressive weight loss. I use the Lipodrops every morning as well. Remember I talked about taking my 3 things? I also squirt the Lipodrops under my tongue immediately after I finish brushing my teeth, hold them under there for 2 minutes while I'm shaving, and then swallow. So part of the regimen that you do, and as you know, Dr. Collier is 32 pounds down. My original weight loss goal was 20 pounds. I got to 20 and said I can do 25. I said I'll give myself a cushion. Got to 25, and then of course I added 5 more, so I can do 30. So now 32 pounds down, maintaining the weight loss, and and looking and feeling much better. I'm an avid tennis player, and guess what? 30 pounds lighter on the tennis court makes a major difference in my ability to get to balls. So my game is back to where it was maybe 5 years ago, maybe 10 years ago, as far as my quality of tennis is concerned. So highly recommended. After I had lost the 20 pounds, that is literally every 5 pounds is a dress size for women and a belt loop for men. Had to start making wardrobe changes because all of my clothes were hanging off of me. I looked like a homeless person. So now I have made wardrobe upgrades, and clothes are fitting. All of my shirts and my jackets are slim fit style. Before they were regular, which was loose fitting. Now they're slim fit, and they still loose. I still can get 2 fingers under my collar, and there's still extra room instead of my collar being so tight and it's bulging out of my chin, bulging out, etc. So good. Again, part of the weight loss program with the Lipodrops. Great question. Next question, Evan. Okay. DeAndre Brown asking this question: can I take phentermine with the Lipodrops and probiotics? Yes, you can. All perfectly compatible. And again, one of the techniques that I use in my weight loss facilities to get more people off, more weight off in a shorter period of time, and more aggressively address weight loss in those individuals. So I find that when I do that, you don't plateau as often, because the first 10, 15 pounds is very easy to lose, no matter what your starting weight is. The problem is after that, your body starts to adapt. Weight loss is an abnormal condition. Weight loss is an abnormal condition. Your body does not like to lose weight. Your body does not want to lose weight. It fights you the entire time. There's a hormone that your stomach secretes called ghrelin, Grelin. I oftentimes refer to it in my weight loss clinics as ghrelin the gremlin. The reason why is that ghrelin is the hormone that tells you to eat. It makes you hungry and it makes you eat. You cannot win against ghrelin. As you start to lose weight, your levels of ghrelin go higher and higher, and it keeps telling you, eat, 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 you're hungry, eat, eat, eat. So it is not that you have a lack of willpower. It is not that you lost the weight and now you're settling in and now you're going back to bad habits. That hormone ghrelin is literally making you eat. It makes you, because your body wants to go back to the weight that it was at previously. That is your thermostat set point. That is where your body wants to be. And that's where it's trying desperately to get back to. So the ghrelin levels keep rising and rising and rising and rising, and it keeps telling you to eat. And eventually you lose that battle. And guess what? When you get back to the weight that you started at, the ghrelin levels don't come down immediately. It still tells you to eat, eat, eat. That is why oftentimes people will lose 20 or 30 pounds and they gain back 30 or 40 pounds, because it takes that long for the body to reset as far as the thermostat set point is concerned. So that ghrelin hormone, and once and there, believe me, every pharmaceutical company in the country is trying to find an anti-ghrelin medication, something that stops that from happening. If they could do that, everybody in America and around the world would be skinny. So they are trying to do that. No one has yet to do it. There are several products in the pharmaceutical pipeline that are looking at this technology, but nothing at this point that's near release anytime soon. So the newest breakthroughs that we have are the injectables, the GLP-1s. The first generation was a medication called Saxenda, Saxenda. Sax like saxophone, ENDA. Saxenda was an injectable. It still exists. It is a daily injectable. It does result in weight loss. It works. So people were taking it, utilizing it, and its only indication is for weight loss. And so it is available, and now readily available because of the newer products that are out there. The Ozempic and the Mounjaro are once weekly injections. So instead of giving yourself a shot every day, you only have to give yourself a shot once a week. The technology is so amazing. The needles are so tiny that you barely are even aware that you're giving yourself a shot. They both have auto-injectors. So you basically put it on your skin of the abdomen or the thigh, hit a button, and you barely feel any pricking sensation at all. And it's over before you can blink. And and you get the benefits of it, and you only have to do that once per week. So that is where we are right now, technology wise. Ozempic, Ozempic. You've heard the song, or the Manjaro. They don't have a song yet, but they're beating the doors down because it is literally the hottest product. They cannot make it fast enough. The Ozempic also, it came out with a new, the maximum dose of the Ozempic was 1 milligram. They now have a 2 milligram dose. Again, it's on back order right now as we speak. I have patients that are on these products, can't get them because they're not in the drugstores, because everybody wants them and everybody's utilizing them to lose weight. So again, talk to both for prescriptions. However, talk to your doctors, go to your primary care. Probably not a doctor in town that doesn't know about these products now. You just got to get somebody that knows how to use them and can utilize them to optimize your weight loss. Okay, next question, Abby. What causes your throat glands to swell up when eating certain foods? That is probably a food allergy that is directly not just your throat glands, but you're probably getting an allergic response all over your body. The great thing that I like, one, probiotics helps with that. Probiotics, God's gift to GI and allergy health, are amazing in helping adjust your body's response to certain foods. But that can be almost dangerous. If you get too much of your throat gland swelling, it can compromise your breathing. And so it's very important that if you're having that reaction, guess what? If that happens when you eat certain foods, don't eat those foods. I have people that know they have allergic reactions to food, but they say, I got to have my seafood. So they'll take Benadryl before they go out to eat and hoping that they're minimizing or won't have an allergy response. Dr. Kai does not recommend that because you can always, your allergic response can be greater depending upon the circumstances. In other words, how much food you have on your stomach, how tired and fatigued your body is, what did you have for lunch versus what you have for dinner, all kind of variables that can determine whether you have a minor allergic reaction, like just a little throat swelling, or major, where your lips swell up and your face swells up. Everybody saw that movie where Will Smith was playing that character, and he ate something and his face swelled up like that. And he was literally drinking Benadryl right out of the bottle. That is actually a real phenomenon. It does happen, can happen, as long as it's in front of your face and your lips, fine. But if it gets into your throat and your glands swollen, it literally can compromise your ability to breathe. And that's when somebody smart will cut a hole in your throat so you can breathe, or hopefully they'll get 911 there quick enough to help address that. And if you ever have that kind of allergic response to anything from bee stings to peanuts, you need to carry and keep on your presence at all time an EpiPen. That will immediately alleviate that response and then gives you a chance to get to the emergency room so you can do other things to control your allergy response. Okay, great question, Luis. Okay, Arnita Norris Grice, do you need to take omega-3 fish oil? Absolutely. Omega-3 fish oil is amazing product because it helps. One, it's anti-inflammatory. It literally greases or oils your joints, so it slows down the progression of arthritis, makes your joints look, act, and feel better, decreases your risk of a heart attack or a stroke, helps with digestion, it helps with food allergies, amongst other things. So they're good natural anti-inflammatories. So one of the things that I found out when doing this broadcast, people allergic to fish, can they take omega-3 fish oil? Some can, some can't. You don't take your chance. Again, depending upon how aggressive your response is to or how bad your allergic response is to fish. There are non-fish alternatives in the omega-3 oil family. Flaxseed oil is a one that I highly recommend. That's flax, FLAXSEED, flaxseed oil. There are other plant-based omega oils that are available as well. Flaxseed is just one of the easy to obtain and a name brand that you can think of. But again, omega-3 fish oils are great. The issue with omega-3 fish oils is the quality of the preparation. The best omega-3 fish oils come from fish that are bottom feeders. The problem is that fish that are bottom feeders, that everything bad in the water that people throw in there or discharging water, toxic chemicals, trash, garbage, etc., floats to the bottom of the ocean or the lake. And the fishes eat those things, and those things are distributed throughout the body of the fish. To harvest the omega-3 fish oil is literally like taking a fish and just throwing it in a blender and squeezing the oil out. So there are products that do that. And when you open the bottle, one, the bottle of the fish oil smells very fishy. It can turn you off. And also, if you look at the capsules are cloudy. That means that is not a purified product. Our omega-3, the lipo omega, is ultra purified and centrifuged so that all impurities are removed. The capsules are crystal clear. When you look through it, you can literally see through it with no distortion. And when you open the bottle, there is no fish smell. So you don't know, you're unaware that this is a fish product, fish-based product. So that is why our omega-3 product is one that I highly recommend. All of our products meet high standard quality controls. They are tested by an outside source to make sure that the quality is maintained. And again, which is why they're not, 100 tablets for $5 like you see in some of the stores. You can get less expensive products, but you cannot get better products. And the objective is to get a product that's one that's going to do what it says, two, that contains what it says it contains. Oftentimes, some of the less expensive products have little or no of what you're trying to take for it, or they have a lot of fillers like various types of powders and things they use to fill and make tablets whole, but they don't have a therapeutic dose of whatever it is. So it's supposed to have 1,000 milligrams. It may have 100. It may not have any. So our products, if it has 1,000 milligrams, it has 1,000 milligrams. And it's purified. It's the best type of product that you can get of that nature. So our probiotic products, our probiotics contain multiple cultures. The thing about probiotics are just good bacteria, but you have to have enough of them. A lot of probiotic products out there have millions with an M of colony forming units, which sounds like a lot, but it's not a therapeutic dose. You need billions with a B, billions of CFUs or colony forming units, and you want more than one type of culture. If you take billions of one type of bacteria, eventually that will become the predominant bacteria in your GI tract. Even if it's a good bacteria, it's not good to have just one thing that's predominating. You want a mixture. And that's why our product has multiple cultures in it. And so our probiotic, very different from a lot of the probiotic products that are available over the counter. And that's why, again, we recommend that. And our vitamin D, the vitamin D has 5,000 international units in a small caplet. People have difficulty sometimes swallowing vitamin D that's got 5,000 international units, but ours are tiny, crystal clear once again, and do contain 5,000 versus 1,000 or 2,000, which are not therapeutic doses. Remember, the FDA recommends only 800. That is a total and complete waste of time, and that is why when they do studies on benefits of vitamin D, they don't find significant study because they're only giving 800 milligrams, which is the FDA recommended dose. But at higher doses, that's where you get the great many benefits. Many studies have shown, again, immune boosting, protecting you from bacterial infections, viral infections, fungal infections, and at even higher doses, cancer preventive. You heard what I said, cancer preventive. Multiple studies that show that high levels of vitamin D in your body will prevent and protect you from various types of cancers, including colon cancer for men and women, prostate cancer for men, breast cancer for women, pancreatic cancer. And so the first thing that happens when a person is diagnosed with cancer, the first thing they do is put them on vitamin D. If they had already been taking a vitamin D, they wouldn't have the cancer diagnosis. So get your vitamin D. Remember Dr. Collier's trio for good health: the vitamin D, the omega-3 fish oil, the probiotics, every day, all day. Thank you. I need a great question. Marilyn Pope Johnson, is bowel salt safe to take after gallbladder removal? I'm not quite sure. It depends on the preparation and a variety of different things. That is not standard therapy. Taking bowel salts after gallbladder removal, the best way to deal with after having your gallbladder removed is to limit the amount of fat that's in your diet. If you eat greasy, fatty, fried foods, you're going to have explosive diarrhea if your gallbladder's been taken out. That is why your gallbladder is a repository for bile, which is produced by your liver. It holds a certain amount, and it's like a perfume atomizer. It squeezes just like this, like a ball. And so when you eat fatty foods, there are receptors in your stomach that says, hey, I just had some fatty foods. The fat is sitting in my stomach. The gallbladder squirts that bile through a duct into the stomach, and that will digest the fat. It is very, very acidic and caustic because fat is very difficult to digest. So that is why the stomach has to have a lining that protects it from the bile proper, because bile, if you've ever been sick enough to vomit bile, you know it burns your throat, burns your mouth, tastes horrible, all those things. So the objective when you have fatty foods is you need a lot of bile to digest the fat. If you are not eating fatty foods, you don't, the standard amount of bile that your liver continuously secretes and it does get into your stomach is enough to digest most foods. So I'm unaware of a bile salt supplement that works under those circumstances. So I'm not recommending that. I think, again, you just have to alter your diet and stay away from fried foods, greasy foods, and foods with a lot of fat in them, because if you don't, it's going to happen. You will not be able to get through your meal before you have to get up from the table in the restaurant and go to the bathroom because you're having, and if you don't, it's going to be ugly very quickly. Okay, great question. How serious should we take heart palpitations and what are they a sign of? Ernest, great question, Ernest. Heart palpitations may not be a sign of anything. Oftentimes, it's like a computer resetting itself, or when you go control, alternate, delete. The rhythm of your heart should be like this. It can do this all day, every day for over 100 years. And when your heart is in steady rhythm, your brain literally blocks out your awareness of it. You just don't feel it. It's happening all day. The only time you may become aware of it is if you lay down flat and all of a sudden you can feel it in your chest, or you can feel it even as the pulse goes up your carotid arteries into your head and your brain. You can feel it. And once you become consciously aware of it, you start thinking about it, and so you're aware of it, and then you may see that when it misses a beat, so to speak, or the rhythm changes, then you are aware of that. And a lot of people just rub, they have this thing called a carotid sinus in their neck. They can rub that and change the heart rhythm. You can sit up and all of a sudden there's not as much pressure. You don't feel it, and it changes your heart rhythm. That is a normal phenomenon that happens in everybody. It doesn't have any pathological indications. But if your heart goes into an arrhythmia, where it is not pumping efficiently, because it should do, like I said, it should do like that. The top of the heart pumps into the bottom of the heart. The bottom of the heart pumps in a rhythmic manner, lubbed up, lubbed up. The top feels the bottom pumps blood all through the rest of your body. That's the left side of your heart. The left ventricle is responsible for pumping blood throughout all of your body. So when that happens efficiently, then you're totally unaware of that. But sometimes with an arrhythmia, it gets out of sync. So the top is pumping at the same time as the bottom, and they're fighting each other, and that stretches your heart out and gives you irregular blood flow. When blood is not flowing and moving, it does what blood does, which is clot. So you can get clots on a microscopic level that can block your peripheral circulation or block the two main arteries in your heart. There are only two arteries, the left and the right. The left branches out into, if you have the left main, then it has two branches and a lot of little branches. If you get micro obstructions in that part of your heart, that's when you have a major heart attack, and most people don't survive it. If you have blockages on the right side, you can lose almost the entire right side of the heart, and your heart will still function because it kind of passively will pump fluid through. Those are minor heart attacks, and the ones that people say, oh, I had my first heart attack in 2000, and I had my second heart attack in 2015, and my third heart attack, and they did a bypass in 2020. When they have that left main block, they call that the widowmaker. You don't survive that because, again, the heart tissue dies. It's not pumping effectively and efficiently. So the blood does not circulate, doesn't go to your brain, doesn't go to your peripheral body, your hands and your feet. So those tissues start to die. And when that happens, you die. It's what happens. So palpitations that result in a cardiac arrhythmia where blood is not pumping efficiently, that can be ventricular fibrillation. So instead of the heart pumping like this, it's just kind of wiggling, doing like this, but it's not moving blood. Again, that blood is sitting there. Blood doesn't move. It clots. You get a big clot inside your heart. Or atrial fibrillation. Or atrial flutter. Atrial flutter, the top part of the heart is not beating in rhythm with the bottom part of the heart, but it's still beating. It's still moving blood. Atrial fibrillation, the heart is doing like that. The blood sits there, and that's a major cause of strokes. That's why so many people on these blood thinners. And one of the recommendations was to take low dose aspirin every day because it prevents clotting when you have that cardiac arrhythmia. And then if you've had atrial fib, then they're going to put you on one of these very expensive blood thinners, to control that. The first generation was a medication called clopidogrel or Plavix. Now we have Pradaxa, and we have several others that are, again, once or twice a day. And you're on it, and you're probably going to be on it for at least a few years, sometimes for the rest of your life, to prevent heart attack or stroke. Great question, Ernest. You the man. Okay. Antoinette Hunter. Is Belister injection okay to take for lupus? Benlysta. That is a good question. I would have to say you'd have to consultate with your rheumatologist. It's not a product that I'm really familiar with. So Benlysta. Let's do what we do. We can look it up right quick. I have what we call is Hippocrates, and we'll look it up and see in real time, because this is your medical ready reference. Okay. It's systemic. It's a medication specifically indicated for lupus. So yes, I would say yes. It seems like it's one that's going to give you, it's an injection. It's an auto injector. So you take it. Here it says you can take it by the IV route, or you can take it by the subcutaneous route. That means you inject it under the skin or into a muscle. You can get it, if you're having lupus nephritis, you can take it IV to get it to your kidneys as quickly as possible. So yes, seems like it's a great product. I have no experience with it. So not one I can endorse, but it looks like it's one of these new injectables are great for autoimmune problems. So it seems like your doctor's on top of it, and that your rheumatologist is giving you a great product to help control your symptoms of the lupus. Thank you, Antoinette. Great question. Carmelita Pryor recommends something to have a regular bowel movement. Yes. Ski wheat, Miss AKA, we appreciate you. Salmon pink and apple green, my two favorite colors. I am an alpha phi alpha, black and gold, and our sister sorority is the AKA. So ski wheat to you, and thank you so much for listening this evening. Yes, so the great thing about regular bowel movements is, one, it's a simple concept. One, your GI tract, your gastrointestinal tract, is one long tube. Your mouth, your esophagus, your stomach, your small intestines, your large intestines, your sigmoid colon, and your rectum. It's all one space. The name changes to protect the innocent, but the function of the large intestines is to store the stool, the waste until it's time to pass it, and the resumption of fluid. So one, you got to keep it going regularly, because as long as if it stays in the colon never turns off. Its full function is the reabsorption of fluid. So the longer it stays in the colon, the drier and harder it gets. So how do you speed that process up? One, the transit time in the gut can be enhanced tremendously with fiber. Crunchy fruits and vegetables are the natural way to do it. And then everybody has that food that they can eat. It may be collard greens, it may be prunes, it may be any fruit, it may be anything that you eat. You know, when I eat this, it's going to stimulate me and make me go. Then eat that and eat it regularly. If eating the appropriate foods is difficult for you, and it can be because they take up a lot of stomach space, it can give you bloating, then you can take fiber supplements. There's FiberCon, there's Metamucil, there's all of these things. But remember, if you're taking fiber supplements, you have to drink enough water. That's the other thing, making sure that you stay hydrated, because again, the function of the large intestines is the reabsorption of fluid, makes the stool, the eliminate, the waste dry and hard. So the more water you drink, the less dry, the less hard, the easier to move. The lining of the colon and intestines is mucousy, and that way, when it's mucus and wet, it makes it slide easily. When it's dried mucus or not mucousy enough, it's very difficult to move that stool. That large intestines is a long process. Starts on the right side of your body where your appendix is. It has to move up against gravity. It turns 90 degrees at the point of your belly button. It moves across. That's called the transverse colon. Then it turns 90 degrees again, going down on the left side to your sigmoid colon and your rectum. And by the time it's on the left side, it should be a solid log that's easy to pass, so that when you sit down on the toilet and push and go, that makes it easy to pass. But if you have allowed that stool to get dry and hard, it's more difficult to do. So remaining hydrated, crunchy fruits and vegetables, fiber supplements. If you're beyond that, you can add a stool softener called Collier. It's not a laxative. It just makes the stool less dry, less hard, easier to pass. And then if you feel like you're stopped up, don't wait until you haven't had a bowel movement for 7 days to 10 days. Take a laxative, clean your colon out. Getting a colon cleanse which is a super animal, so to speak. They clean your colon from stem to stern. There are places that do that, and it's a very clean process. It's not what you think it is, but it will empty your colon. But even if you take a laxative to do that, it may be 3 days after that you have another bowel movement, because that is the standard transit time in the United States for the foods that we eat. Okay, that brings to a close this episode of the Your Health is Important Facebook Live broadcast. I want to thank each and every one of you for tuning in today. It has been an amazing process. I hope we answered your healthcare questions. Remember to tune in live. Go to all social media at Ask Dr. MJ on Facebook, on Instagram. Go to my YouTube channel. Sign up, sign in. Ask Dr. MJ. Follow me on Facebook. I'll follow you back, I promise. And go to our website, lipodrops.com, so that you can purchase and get more information about some of the products that we talked about this evening. Remember Dr. Collier's Healthy Trio, the probiotics, the vitamin D, Doctor's D, and the omega-3 fish oil. Those 3 things. Stay healthy. We'll see you next time. Tune in to the Ricky Smiley Morning Show, where you can hear me on Wellness Wednesdays talk about your healthcare issues. And remember, Facebook Live Wednesdays at 6:30, the only interactive healthcare forum that allows you to tune in and ask your healthcare questions. Thank you so much for a wonderful evening. We'll see you next time. Thank you, Havlik, for all you do. We appreciate you for call screening.